was like, forget it. Like, you're nervous. That's why you didn't send it yesterday.
Oh, yeah. And I did the other one.
Hi, everyone. Good afternoon. This is Bethany Hamilton, co-director here at the National Center for Medical Legal Partnership. We're running live on Zoom and recording our webinar today. Sometimes technology doesn't work as expected, so we know we can hear for some of you logging in today, your background noise. So please do us a little favor, go ahead and put yourselves on mute. We thought it was a default setting, but again, technology is what it is. And so as you enter, welcome, welcome, welcome. Please make sure you are on mute. So again, good afternoon. I'm Bethany Hamilton with the National Center for Medical Legal Partnership. I will only be speaking briefly today because we will be joined by some subject matter experts from the field for today's Closing the Loop on the Referral webinar. They're going to be talking about how a health center MLP, or Medical Legal Partnership, managed to crack the code to facilitate electronic data sharing between partners. I'm also joined by my colleague, Danielle Rahajison, here at NCMLP. She's our project lead. So next slide, please. For those of you who are in the waiting room, as we continue to allow folks to log in and join us today before the content kicks off, just want to, and I don't need to remind you all that we are perhaps beyond an eviction crisis and into an eviction emergency. So if you didn't get the link while you're in the waiting room, HRSA as well as others are sharing the CFPB resource for folks to use to be able to find resources in their states or localities for rental and utilities assistance. So please, please, please bookmark and share that link with your patients or clients. For those in the health center world and other healthcare providers that are joining us today, we would greatly appreciate if you wouldn't mind sharing this in whatever way possible on your websites, through your text message campaigns and your EHRs. Please share this resource and disseminate it as broadly as possible throughout your organizations and with your clientele. Next slide, please. All right, so just going through the housekeeping again. Hopefully as you join, you will be on default mute settings, but if you aren't, just know that I'm sure your conversations are super important. We probably shouldn't be overhearing them, so go ahead and make sure that you are on mute. This session is being recorded, and yes, 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 as everyone always asks, the slides will be shared along with the link to the recording so that you can view it later as a resource and further share it with your colleagues. You are welcome to share any of your questions or commentary in the chat box. For those of you that were in the waiting room, you did see that we were using the chat box to communicate with you and our speakers today. I also appreciate your commentary and remarks in the chat box so that they can engage with you via Zoom. Speaking of engagement, please engage in our polls. We're going to be running several polls today to get a sense of how you are receiving the information, what you're doing currently at your delivery sites, and then finally, as is required, especially by our sponsor for this project, HRSA, we will conduct a follow-up survey. And so you'll hear from Danielle at the end, who will walk you through that poll. If you have any trouble today with the webinar, if you need to follow up with us afterwards, you can email our colleague, April Daniels, who's running tech behind the scenes at aprilDaniels@gwu.edu for help. Next slide. All right, so as I mentioned, today's webinar is in fact sponsored by HRSA. They fund this project where we provide national training and technical assistance with other partners to health centers, and in our case for implementing health center MLPs and helping the field really integrate the screening and delivery of legal services and addressing the legal needs of community health center patient populations. We are always, and you are always welcome to join us. We are always joined by other healthcare organizations and other partners and stakeholders as we carry out our social determinants of health interventions work. So stick around with us because this information that will be presented today, we do believe is applicable to all of you joining us. Next slide. So around the country, there are currently about 163. We know this number is an undercount right now because health centers represent the fastest growing group of MLPs around the country. But as of last count, we were at about 163 of the definitely over 450 MLPs around the country. How do we all and how should we all be defining MLP? What we like to say here at the National Center is what shows up on the screen. Medical legal partnership is an intervention. Sometimes you may hear us refer to it as an approach where we're bringing together legal and healthcare professionals to collaborate and ultimately help patients resolve those social, economic, and environmental factors or needs that contribute to the health disparities that we see playing out even today and may have a remedy in civil law. Around the country, every MLP has about 8 basic components. So in the next slide, I just want to show you what those 8 components are in general. And then if we go to the next slide, I'm just going to highlight the 2 that are going to be addressed here today and can create some of the most hurdles when it comes to sharing information and carrying out the most impactful MLPs and the MLP work. But it can be overcome. And so these 2 areas, if addressed the right way, you can also have the greatest amount of impact and have the data that you need to provide evidence related to your evaluations and the impact that you're having around your communities. So we're joined here today by Siouxland Community Health Center and their legal and HCCN partners, as well as one of our national level subject matter experts, Mallory Curran, who helped to lead a project helping Siouxland Community Health Center and their MLP really overcome one of those greatest tech challenges or hurdles that I talked about. That's closing the loop on the referral. We know you all are doing the screenings. We know you all are making the referrals for various types of social and legal needs. Interventions, and you're working with community partners, but oftentimes it's really difficult to then receive that information back into the systems and databases that you're utilizing. And the team that will be presenting today will share some of the best practices to help you all as health centers and other healthcare providers that are joining us today really advance your MLP practice to be able to go way beyond just the screenings and referrals to then the real-time tracking and analysis of the interventions that you're carrying out and have that data go exactly where you want it, which we assume is the EHR. With that, I'm going to turn it over to Mallory Curran to introduce faculty members for today. And thank you all again for joining us. And for the Health Center folks, happy National Health Center Week. Mallory, all yours.
Thank you, Bethany. And hi, everyone. Looking at the names of our participants, a lot of old friends. So welcome. It's wonderful to have you here and a lot of new friends too. So thank you so much for joining us. Again, I'm Mallory Curran. I was an MLP attorney in Cleveland and New York City. And then for the last 6 years or so, I've been working with medical legal partnerships across the country in a variety of areas with a focus on technology. I'm joined today by Dave Faldmo from Siouxland Community Health Center. He's their medical director. I'm also joined by Aaron Planalp, a managing attorney from Iowa Legal Aid, and Shannon Pohl, who's the director of informatics at Alliance Chicago, which is an HCCN that serves health centers in many states, not just in the Chicago area. So to get us started, we're actually going to start off with a poll to give us a sense of who we have with us. So if we could, April, if you could launch our first polling questions. So it looks like we're having a little bit of a challenge with launching the polling questions. So I'm going to go ahead and jump ahead and talk about.
They're running, Mallory.
Oh, great. I can't see them, but everyone else can. Oh, wonderful.
Okay.
Okay, good.
Yep. They're running. So I can, do you want me to read it out?
Yeah, if you can, Bethany,
Sure.
That's great.
Sure. So the first polling question on the screen is about your professional setting, MLP, or whether you're closing the loop. The question is, which of the following best describes your professional setting? Number 1, are you a healthcare or behavioral health provider? Are you legal aid or legal services or law school? Are you at a law firm or pro bono partner? Are you with philanthropy or government? And then there's an other category. The second question is, are you currently part of a formal medical legal partnership? I see folks answering this already. So thus far, about 57% of you who are answering are saying, yes, you do have an MLP. About 37% of you are saying nope, and some are saying not sure. The third question is, if you work in a healthcare setting, which of the following best describes your ability to close the loop on social and legal referrals? So far, about 35% of you are saying it's pretty clunky and time consuming. 57% are saying it's not great, but it's okay. And about 7% are saying it's streamlined and you're happy with it. For the breakdown, let's see if we can close the poll, but I'll keep in mind what I'm seeing on the screen for who's here today from which settings. Not sure if you can see the results now, Mallory, but I can read those out for
No, I can't see them. If you can, that would be great.
No problem. Sorry about that. All right. So for who we have here today, about 44% of folks are from healthcare or behavioral health care providers. 40% are from legal aid or legal services or law schools. We do have about 2% from law firms or pro bono, 1% from government or philanthropy, and 12% in the other category. Thank you all for completing the poll. So for folks who aren't able to see the results, we do apologize. We'll figure out how to perhaps share it. Just for the sake of the presenters today, for those who said other, maybe share with us in the chat where you're from, and thank you.
Great, thank you so much, Bethany. And it's wonderful to have such a nice mix between our healthcare and behavioral health teams and our legal teams, and as well as a mix between people who have medical legal partnerships and those who don't. Congratulations to the 7% of you who feel like your ability to close the loop is streamlined and you're happy with it. I'm sure we could all learn from you, and our focus is really going to be on those of you who feel like it's a bit clunky and time consuming, or it's okay but not great. So we're going to talk about how we moved from clunky and time consuming to much more streamlined with the Iowa MLP with Siouxland. I also want to do a little bit of managing of expectations about what we're going to talk about and what we're not going to talk about. This is not a sort of beginning MLP call. So we will be sharing some resources at the end of the call if you need to become more grounded in what a medical legal partnership is. There's some great resources that have come out of the National Center in the last year or two, and so we'll make sure that you have links to those. And then also, I think that we on the Iowa team would hesitate to call these best practices. We would say more that we are on a journey and we feel really good about where we started and where we are so far, but we have a lot to learn. But we do think that we're going to give you today some building blocks that you'll be able to take back to your own setting and start thinking about applying there. I also want to acknowledge that the Iowa team members, and I'm really looking at Siouxland Community Health Center, at Iowa Legal Aid, at Alliance Chicago, as well as the Iowa PCA and their sister organization In Concert Care, which is their tech-focused group. They're really pioneers in what we were doing. We didn't find anybody else who was able to send data back from the legal team into the electronic health record. So it's often exciting to be a pioneer. It's often not easy to be a pioneer, and that's certainly been our experience. And today we're going to be showing examples of what Siouxland and Iowa Legal Aid are doing in the areas of screening, in referrals, getting patients over to the Iowa Legal Aid team, and then closing the loop back, information going from Iowa Legal Aid to Siouxland Community Health Centers. We can't really talk about doing the electronic referrals and electronic closing the loop without first talking about screening, so that's what we're going to do first. And we'll also share a resource that the Iowa team produced that really outlines what we did. So after this session, if you're really interested in what we did about screening, you'll have a link to get to our piece called Leveraging the Electronic Health Record to Link Patients with MLP Services. I had mentioned some of the resources that we'll be sharing. This is really the MLP 101 that you want to go to, whether you have a new MLP, existing one, or a growing one. And then we did look through the questions that people submitted prior to the session. I know that a lot of people are really interested in talking about HIPAA, about confidentiality and privacy. And of course, this is all very, very important. We'll also be sharing a resource about information sharing in the Medical Legal Partnership context. We are going to touch on those issues today, but we're not going to do a deep dive. I just want to manage those expectations. Of course, different health centers have different culture around these issues. And our starting point really was, if our patients provide consent for us to do this, we want to figure out a way to do it. And if our patients want us to share information so they can get legal help, we want them to get there. Certainly not every patient is going to say yes. And of course, their wishes must be respected and their information not shared. Okay, so I'm going to go ahead and have us take a step back. I'm going to turn it over to my colleague, Shannon Pohl from Alliance Chicago, and she's going to talk about why is it important for us to think about technology solutions to solve some of these issues that we see with legal referrals. And again, the concepts that we're talking about are going to apply to legal referrals, but also really to many of your other social services referrals as well. So Shannon, if you can walk us through sort of the big picture before we get into the details.
And great, thanks, Mallory. And before I get started, just want to check the sound. Everybody can hear me okay?
Yeah, you sound great.
I'm seeing some head nods, so thank you for that nonverbal virtual communication that we're in. I'm Shannon Pohl, Director of Informatics from Alliance Chicago. We wanted to touch on the why. I think when we engage, especially in these kind of innovative pioneer projects, if you will, we always want to be focused on that kind of shared value of why we're doing these things. And certainly, I'm sure a lot of you can resonate with these points. I think first, just opening access to communication, making sure that that the technology that we're using is enabling resourceful communication pathways to make sure that everybody that's involved in the process of assessing a person's health harming legal needs have access to that info, right? And then from that access and the communication, how can we automate it? How can we make it more efficient? I think this concept of burden, especially heightened in this COVID-19 pandemic, cannot be ignored, and it's certainly significant. So how can we work smarter, not harder? Continuity of care and patient engagement from a health center perspective, I see this a lot, not just in this project, but in also other projects where patients are able to see that you care about them, that they positively are impacted and engage more in their care with you and in establishing that relationship. Certainly in community health centers, we're all about that community, right? Maintaining that community, maintaining that engagement. So if a patient sees that they have many advocates on the health and the legal side advocating on their behalf, that can have an overall positive downstream experience there for overall continuity of care and patient engagement. If we go to the next slide, we wanted to talk about, the ideal state. Certainly the pandemic brought to light the opportunities and how health and legal services currently communicate. And it's also kind of a decision point about we can't go back necessarily to how things are anymore, right? So how can we push towards that journey of the ideal state of what a medical legal partnership should look like? How we're sharing information, how we're using technology, and what incremental steps can we do to get there? And then certainly the fundamental truth, if we can't effectively answer that multi-million-dollar question of how does medical legal partnership impact health outcomes, if we aren't screening for it, tracking the data, tracking the interventions, and seeing if we can get those answers. So whatever we can do in this journey to answer those questions. All right. So if we go to the next slide here, we wanted to first talk about, before you're sharing information, you got to be screening and checking in with the patient on their health harming legal needs. So we wanted to offer some options for you. I hope that you have heard about the NAC Prepare tool, or the protocol for responding to and assessing a patient's assets, risks, and experiences. That has been increasingly the gold standard for social determinants of health screening at many of our community health centers. I encourage you to look it up if you're not familiar. There's also additional tools that are available out there. I pulled a couple of them. These are by no means all inclusive. The American Academy of Family Physicians Social Needs Screening Tool, the Centers for Medicaid and Medicare Services health-related social needs screening tool. Something that you may want to consider also is a homegrown tool development, or a combination of both, where you're screening at a higher level using one of these social determinant screeners, and then honing in a little bit more on health harming legal needs that we'll show a little bit of today. Just some thoughts and considerations as you think about that journey. So do some sort of analysis to determine what a homegrown tool would provide more successfully versus the standard tool if you're doing a replacement, or where you want to fill in the gaps where the general screener isn't working for you. And then just also expect that with any sort of workflow or way that you're doing things, that there's going to be maintenance, that there's going to be support, and there's going to be iteration on it. And so that'll come from the real life experience of doing the operations and the workflow of the medical legal partnership in real life with real patients and real people. So expect the fact that you may need to hone in on it a little bit more, update it, revise it, that sort of thing. And then whatever is chosen, you know, translating it in a fashion that makes sense. You know, some of these tools, or perhaps looking at it from a health lens, looking at it from a legal lens, there's kind of that sweet spot of that there's a translation point that you got to think about in the workflow, and what does that look like from a human perspective, from the patient experience perspective. So thinking about those things as you decide on screening workflows. If we go to the next slide here, I'll turn it back over to Mallory.
Great, thank you, Shannon. So the specific project that we're going to be talking about today is the Advancing Medical Legal Partnership Through Technology grant, which we received from the Legal Services Corporation's Technology Initiative Grant Program. So I wanted to say thank you to the Legal Services Corporation for funding our work. And I also want to acknowledge the Montana Legal Services Association, which is the lead grantee on this project, as well as the National Center, which also supported our work. And we started this project about 3 years ago and worked in different phases. So our first phase was on screening. We've already talked about the team members here. And we are going to talk about screening. As I said, I'm repeating myself, but I think it bears repeating. First, we're going to talk about screening. Second, we're going to talk about referrals. And then third, we're going to talk about closing the loop. And again, we feel like you need to know who needs help first. You need to get those people to your legal partner, and then you need to find out information back from your legal partner. So Dave Feldmo is going to do the demonstration for us so you can see how Siouxland Community Health Center conducts their legal screening, how they're documenting positive screens. And then we'll take a pause before we then move on to talk about how the referrals get over to Iowa Legal Aid as part of our phase 2. This is the resource that I mentioned before that really documents a lot of what Dave is going to talk about today. So take notes and pay attention to everything that Dave says, then you can also refer back to this document. So I'm going to stop my share here for a moment, turn it over to Dave. Dave, would you like to share your screen, or would you like to have Shannon share her screen and then you walk her through?
She got lost.
Okay. Dave, we are able to see your screen, so you can go ahead and start us through the demonstration.
Okay, can you hear me okay?
Yep, we hear you great.
Okay, so again, my name is Dave Feldmo, and I'm a practicing PA, a physician assistant, and serve as our medical director and quality director at the Siouxland Community Health Center here in Sioux City, Iowa. We actually serve a tri-state area of Nebraska, South Dakota, and Iowa. And so this has been a great project to be involved with. We were really involved with Shannon and the Alliance of Chicago with the prepare work of developing the social determinants of health screening tool called Prepare that Shannon referenced. And we felt strongly that even though a lot of times a legal need will surface because of a social determinant of health like food insecurity. Why are you food insecure? Well, I lost my food stamps, and okay, there might be a legal remedy to that. But sometimes we felt that there's many legal needs that may not surface just going through the prepare. So we wanted it part of our assessment that we do. We try to do this annually for all patients. And we do a pretty good job with that, but I'll just show you the form here. And so the form starts with just a review of their past screen that you can see right here. And then there's different tabs across the top. And here's the social demographic, social economic, the money and resources. You can kind of see some of the ones here that, maybe they're food insecure and having problems with childcare. But we do have a specific button here for legal services. So if I click on that, it'll bring up the legal screening tool that we have. And so again, there's different tabs across the top to kind of categorize different legal needs that they might have. And I'll just go to housing and utilities, and maybe they're having utility payment problems with we can't afford it, and you can put a comment in here. And once we have that done, and I'll show you the other tabs too real quick, personal and family stability, maybe they're having child custody issues. There's do you need to write a will or name someone to make medical or financial decisions for you? So there's all these different categories. And the nice thing about this, if the screener kind of wonders what that really means, there's these jump buttons here where I can, patient might describe this issue as needing a will, wanting to create a health care power of attorney, or wanting to create a financial power of attorney. So if the screener doesn't really know what that's asking for, you can click those help buttons there to help. And so there's this last tab here, any concerns about student financial aid and all these other ones. So once I have that done, I may want to look just to see, have we ever made a referral before? And I can click on this tab here, and it lists the feedback we've received from previous referrals. And so maybe this has been a recurring issue and the patient doesn't mention that, and I can go in and see if that's ever been sent before. So once we identify need and find out if the patient wants to receive some help from legal aid, we get a written consent. And so there's this print referral letter that I can click, and that's going to generate a referral form and a consent. And so that we have them consent, and because this is an electronic closed loop referral system, we don't actually have to fax that. We used to have to fax that referral letter with their consent on it to legal aid. But now once I click that written consent to share information with Iowa Legal Aid has been completed, I can click that button, and this referral will automatically go to Iowa Legal Aid. And so that's how we make the referrals from the screening tool that we have just right within our EMR, our electronic medical record. So you can see all the forms that we go through. We don't use each form in every single visit, but all these forms are right within the visit with the patient as I'm sitting right with them. And the way we do it at our health center, though, we have a paper form that we usually have them fill that out while they're waiting for the provider to come in the room. And it has all the social determinants of health questions on it, plus the legal aid need. And it gives them the most common examples of something they may need help with. And so, because sometimes if you just ask someone, oh, do you need any help with any legal needs? It doesn't even come to mind, oh, maybe I could get some help in this particular problem I'm having. So we have some common examples and they can just kind of circle that, but then we'll bring up this form and actually enter it into their electronic medical record. So Mary, do you want me to show the history views and everything right now, or is that enough?
Yeah, let's hold off on that. This
Okay.
is great. Thank you, Dave.
You bet.
So Dave, if you don't mind actually stopping, or one more thing I wanted you to show, sorry, I asked you to stop your share. If you can reshare.
Okay.
I can't, while you're sharing, I just want to say, I can't emphasize enough how important it was to have input from Dave and other clinicians on this process. So there's, things that if you're not a clinician, you just can't know or understand about their workflow. And so one of the things that I wanted to mention, and Dave showed you in the prepare section, the jump button over to this legal screening. That was something that Dave suggested. We wanted to make it as easy as possible for the clinicians to be able to bounce back and forth between prepare and the legal screener. And then Dave, if you jump back to the legal screening, you'll see that at Dave's request, we also added a jump back to the prepare screener so that if something came up while you were discussing the legal issues, you can bounce right back and forth between the two. So there's many, many examples I could give about how central Dave and the other clinicians' roles at Siouxland were in this process, but you absolutely can't be successful if you don't have the people who are doing the work on the ground, part of designing what you're trying to do.
I would mention too that these, sometimes, do you have any health conditions that make it difficult to your job? Without clicking that yes, I really don't know maybe some of the scenarios that might be affecting that. And if I click that, you can kind of see different examples or categories of that particular question.
Yep, and for the legal aid lawyers on the call, those more specific sections correspond to the legal services legal problem codes. So thank you, Dave. If you can go ahead and stop your share, I'll restart my share. Whoops, and I lost my, one moment here. Okay. There we go. I know we wanted to sort of reshare this a little bit. I know it was a little small when Dave was there, and Shannon also put in some nice, the word is escaping me, but giving you a little more context there. So you can see at the top, the tabs, income and insurance, housing and utilities. People who are familiar with the iHelp mnemonic to help categorize the different types of legal problems people see will recognize those up at the top. And then also that the previous answers to the questions are displayed there. And then also Dave had showed us when you hover over that question mark and more information pops up, we just wanted to show you what that looks like. So that also came directly from feedback from the clinicians at Siouxland, that it's like, well, I kind of understand what you're getting at with this general question, but I sure could use some more specific context. So we provided that there. And then he also showed when he clicks yes, that those other categories show up so you can see those a little bit more clearly on the slide. And then this is an example of at the end of phase 1 of the project, this was got faxed over before we set up our system where it happened automatically. I also want to reference back to that health center toolkit. There are several sections that touch on what we're talking about today. So please don't forget to go and look at part 2 of that toolkit to really help you think through screening. Okay, I'm going to go ahead and have Shannon talk a little bit about a readiness check for you to think through what are you ready to do and what do you need to do to make it successful to do some of this screening in the electronic health record. So we'll do that. We'll do a couple more polling questions, and then we're going to move into our phase 2 where we really got things streamlined electronically.
Great, thank you, Mallory. Thank you, Dave. And I just wanted to address a question I saw in the chat in terms of data that you're collecting as this workflow is going through. So all of the items that you saw in the electronic health record are tied to structured data elements that you can then track for reporting. So then you can check on specific categories. So how percentage of patients seen over the last month that had an income or insurance problem. Those that answered yes to a specific question, those that offered consent, that sort of thing. So data is definitely at the top of our minds as part of this journey because we want to answer that fundamental truth. Okay, so if we go back, thank you, Mallory, for navigating, much appreciated. For the readiness check, definitely the team approach, echoing Mallory and Dave's sentiments, you got to have a cross-functional team available: clinical, legal, operational, EHR and technical, care coordination, being mindful that sometimes it's not just real time in a visit with the patient, but also perhaps in between provider office visits that health harming legal needs are identified as well. Screening tools, so how and what are you going to be using? That translation point, right? So how are you translating whatever that you're doing into acting on health harming legal needs? And what does that look like? Knowing that each workflow may look a little bit different, or you may have a topic of interest that you want to focus on, perhaps as a result of the pandemic. You want to focus on housing or eviction risk, for example. Workflows, what are you trying to achieve? How will the patient experience feel like? How is the patient's information protected and kept safe? So being thoughtful of kind of all of those kind of forks in the road of where, if you do one thing, what happens next, and when does the information go? Like, what's the trigger and what's the source of truth? Data, so to that person that asked about data, what do you want to track? And then making sure that that's enabled in the solutions. The technical development, so for those that are working in health centers and using electronic health records, every EHR is different, and then your support model is also varied. Sometimes you may have to work with the vendor, sometimes you have the capacity to do your own development, sometimes it's a combination of both. So as a result of the workflow and what you want to do, the technology that you want to do, engage your EHR team to see where the limitations are, where the opportunities are, and we'll talk a little bit about that later on. And then your budget, okay? So thinking about not only the technical pieces, but then also gauging the admin time and the time of the resources engaged in the project, and then any sort of ancillary costs as a result of that. So just thinking about that, okay? So if we go to the next slide here, I think we got another poll to kick off here, right, Mallory?
Yes, and so if April can launch those polling questions, and then Shannon, if you don't mind walking us through the questions, since I'm not able to see them on my screen, that would be great.
Let's see here, wonderful. Does your MLP screen for unmet legal needs in a systematic way? And the answers of yes, no, or kind of, or I have no idea. So we'll wait for those things to come through.
Yeah, and I'll say systematic could be on paper. It doesn't have to be a fancy thing. So just thinking about, do you have a plan for who gets screened, how they get screened? You have stock questions and so on. So again, it doesn't have to be fancy to be systematic.
That's right. And we're getting a mix of answers, about 47, 48% yes, 23% no, 30-some% kind of, all right? And then the next question, does your MLP screen for unmet legal needs in the electronic health record system that you use? Yes, no, or kind of, I have no idea. And we got about 22% yes, 51% no, and 20% kind of, I have no idea.
Great, thank you, Shannon. So hopefully what we've done so far is really giving those of you who are not doing systematic screening or not doing it in the electronic health records some screen for thought about how you might move in those directions. Okay, so now we want to move on to the what we find the really exciting part, the phase 2, making the referrals from the EHR electronically. We'll have Dave. Dave really set us up for this already. So actually, Dave, you don't need to share your screen again. Shannon prepared this. Dave had mentioned this checkbox here at the bottom, written consent to share information with Iowa Legal Aid has been completed. So if that box is not checked, the referral will not go forward. And the Siouxland staff, of course, are only checking that when in fact they have received the consent from the patient to make the referral over to Iowa Legal Aid. So at this point, I'm going to pause my share and then pull up a different screen here so that Erin Planalp from Iowa Legal Aid can walk us through what receiving the referrals is like on her side.
Thank you, Mallory. So Iowa Legal Aid uses PICA as our case management system, but I'll try to speak generally and for those of you that maybe are using something different. So I think for us, the first question we had to ask is, in our workflow, where did it make the most sense to have these referrals slotted in? We were fortunate enough to already have an online intake system. So Mallory, if you will go to shortcuts and where our online intake queue lives, we just slotted them here. The system was already in place, so it made the most sense. So when Siouxland has done what they need to do and written consent has been obtained, it kicks it over to our queue here. And if you want to just click into one of those to show what it looks like, that would be great. So those questions that Dave showed you are all just going to be listed right here into a case note, which is great. And as Mallory mentioned, and I'm sure we're happy to share the spreadsheet on how we put this together, but we correlated those questions and organized them not only by iHelp category, but by our LSC problem code, because that makes it a lot easier on our end for our screeners. So and can you scroll up just a little bit to see? So this is all automatic through our system. So it's going to create the client card because it's pulling all of that data from the EHR that we need to get this started. So from there, our screener will pick the information and reach out to the patient to fill in the blanks on the other things that we need to know to then connect them with an advocate to talk about that legal issue. And there was, and I'll mention one thing briefly. There was a question about, again, about data collection and if there's something standardized. We did a poll across many MLPs to kind of get a checklist for us, a working checklist on what folks would like to be tracking, and we worked from there. So I don't know that there is something standardized, but we've tried to be as consistent with other programs that are doing similar projects.
Yeah, thank you, Erin. And there, I can try and come up with a link that shows actually those of you who use Legal Server, and even if you don't, on their website, they actually have a list of standard MLP fields that are available in that case management system. And those really mirror the ones that are also available for Iowa Legal Aid and PICA. Okay, great. So I'm going to pause here again. And thanks to everybody for your patience as I'm clicking around.
While you're clicking around, I'll just answer that question that popped up. We are only getting these referrals from Siouxland since that was this project that set the whole system up. So right now, just with Siouxland. Okay,
great. So let me present again here. So these are just screens that we had as backup. We've already talked about these. Okay, so now we're going to move on to the sort of phase 2, part 2, which is closing the loop on referrals. So we're going to talk about what Iowa Legal Aid does when they are ready to let Siouxland know information at 2 really key points. And again, identifying 2 different points really came out of our conversations with Erin and her team, as well as with Dave and his team, that we realized that we wanted to share information pretty close to the time that the referral was made. Like, did a referral come through, or were we able to connect with the patient, or weren't we? And then we also wanted to be able to share closing information, outcome information, what happened at the end of the referral, which those of you who are in MLPs or our legal team know that could be days or weeks till the case was closed. It could be months or years until the case was closed. So we wanted to make sure that there were 2 different points where that was happening. So again, just one moment here. I'm going to pull this back up so that Erin can show you what it looks like on her side.
And the screen that Mallory is going to show you is, this is a specific tab that we built just for our MLP data collection. So will you show them the checkbox first under the MLP tab? I'm sorry.
Sure. Yeah, of course.
So we have our specific data points here that we're tracking. And the most important thing that we wanted is we don't want to report back to our partner without our client's permission first. So just like on the Siouxland side where they have their little checkbox, we have our own checkbox. And until we get verbal authorization from our client, which we document in notes, we don't check that box. And then, obviously we can't report back. So so like Mallory mentioned, we have, there's 2 opportunities for us to report back. And the first one is just, the title of our presentation, to close the loop, to let our partner know that we got the referral, we've connected with them, we're looking into it. So that is our first report. And so, yeah, Mallory's showing you one of our drop downs. Once that is selected, then this first little these are where we send our reports. I can't say enough about our programmers and the people that we worked with that built this magic rainbow bridge. Is the only way I can think to describe it. It's amazing. But we wanted to, when we are closing that loop, we also wanted to track who is sending this report. So that's why we have the text box there where we can put in a name, date, or however I guess you wanted to do it, and then send it over to Siouxland. We're not going to actually click it because we don't want to mess. We don't want to actually send this. But I do believe that Mallory, did you pull up the initial report?
I have a closing report, but not the initial report.
Okay, that's fine. So so on this initial report back, it's very bare bones. It's really just, patient name, MRN, since that is how they're going to, link it in their system. And to say that, either yes, intake was accepted, or no, it was rejected. And just like Mallory, I'm sorry, go to that drop down one more time. The referral received result up a little bit.
Oops.
Sorry about that. So for those of you on the legal side, one of the things I really wanted to see was a better explanation to our partner on what happened with that referral. So many times, just a simple incomplete or rejected did not tell the story, and so we wanted to just kind of give some better options here for that initial report back to let them know what actually happened with this patient that they sent over to us. So that's that drop down. So that's the initial report back. Once we are finishing up the case, so we're closing it out, as part of our closing process, we're going to get everything coded, and then we have our final report back. Thanks for doing all this coding on this test one, Mallory. Appreciate it. So it's in that same spot under our admin tab, and it's just below the initial referral report. So you scroll down just a little, just a tick more. Closing outcomes. So again, as our advocates are closing out a case, just like they did with the initial report, they're going to make sure all of their coding is saved, and they're going to submit the final report to travel back over that magic rainbow bridge and go back to Siouxland. And this is what we came up with as a template. And the initial report looks very similar. It's just much more bare bones than this. But from the legal side, we wanted to be very intentional about the data points that we were sending back, because as you know, we don't want to cross that line of breaking our confidentiality, considerations for our clients. So we really picked the things that we thought were the most important, which were the level of service. So how much, what kind of work were we doing for them? And then the outputs, did we go to court? Did we investigate? Did we prepare documents? And then also in that left column, we have potential financial benefit. So one way that we track financial benefit through a partnership is if we do some sort of work for a patient that results in them, gaining insurance eligibility or getting a procedure paid for, or we put more money back in their pocket through a collection case or a child support case so that they're now able to afford their private insurance or self-pay. We want to make sure that we are capturing the date that should be tracked from. So their Medicaid eligible date, Medicare, private insurance, or self-pay. So we can then report that back to our medical partner. So in their billing department, they can go back through and count payments that have come back into their pocket. Oh, and we also have a case summary section. So that's we have an option if you want to do a couple sentence narrative, if it was a really great story that you want them to know about.
Okay, great. Thank you, Erin. So hopefully that's giving you a good sense for the legal team. I'm hoping that a lot of this seems like familiar things that you do all the time. And then for our healthcare partners, I hope you feel a little bit as though the curtain has been pulled away and you see a little bit what's happening on your partner side. That was something that as our teams were communicating was like, oh, so interesting. We didn't know really what the legal team did within their system. So we wanted the opportunity for people to see that. Okay, just one moment here. I'm going to pull up, resume our share. Okay, so Dave, if you like, I'll just use these slides, or would you rather share your screen to show what happens on your side?
Either way, I'm ready if you want me to share.
Okay, let's do your share then.
Okay. All right, can you see that okay?
Yep, we sure can.
All right, I hope these are the ones that you wanted to share. So this is the same patient, and this is a test patient. We're not sharing any patient information here of a real patient, but so you can see the line here, external others, the type of document, results of legal referral. So as I come down here, I can see that the referrals were for wills and estates, and that they did accept that referral, intake completed and case accepted. And so that's the first notice we get back, that the case was accepted, or they can send it back that they didn't, you know, they couldn't help them. That will come back to CS2. And then the case outcome is a different title here, legal case outcomes. And so same thing, wills and estates is what they were sent for, obtained a living will or help proxy or power of attorney, completed a will for the patient, assisted with preparation of legal documents. And so I know that that was a successful referral, and that it's closed now. Do you want me to show them the history view, or is that later?
No, go ahead for it. So
Okay.
I'll set it up. So you may be looking this and being like, it's kind of hard to read this, which it absolutely is. And so we knew that we needed to create a better way for Dave and his colleagues to be able to view the information. And again, we really relied on Dave and his team to let us know how they wanted the information to come in. And Dave said, I really want it to be just like a lab result. You know, on my desktop, I can see the lab result has come in. I need to click on it and check out what's going on. And that's what we did here. So Dave, I'll turn it back over to you.
Okay. And so we have a history view that you can see, it's just a view of a bunch of different types of looks that we want to see. And so this is the legal services view. And so I can look back and see if I'm seeing the patient, I said, didn't we do something with, a particular need they had? And I can come back and review what's been done in the past. And so at first it shows any legal screenings that were done, cases that were submitted to legal aid, and then the case closures. And so again, it's pretty just a concise review of what happened with that particular referral.
Great. And then Dave, can you also show, so that's the history view, which can be viewed outside of an encounter. And then Dave, can you go back into the legal screening to show where you can view the information while you have an open patient encounter?
Sure. So again, I'm in a encounter. This is a document, the office visit, and at the very last tab here is the case information, and it has that same information right within the visit, where I wouldn't have to even get out of the document for the visit and go to the history view and review it, or search through the documents, to see what had been done in the past. It's just all right here. So it's really, really nice. Because as medical providers, you're clicking and looking, going from form to form to form. And so just to have everything right here within the office visit has been really, really nice.
Yep. Thank you, Dave. And I want to say one other quick thing that Dave had encouraged us to think about was who would receive the notification that a referral, information about a referral had come back in. And so we decided, rather than do the primary care person listed as the PCP, that we wanted the person who did the referral. So I know earlier in the call, we were talking about care coordinators or patient navigators or community health workers, whatever types of folks you might have at your health center who are really doing, having the longer term intensive relationship with your patients, building that trust, really finding out what's going on in their lives. They're often the ones who are actually doing the referral. And so they're the ones who get notified when the information comes back in. Mallory,
can I just share a little bit about that? So I just think that's so important, because as a provider, you're so busy, you have so many things to think of. but the person that really wants to know that the loop has been closed on a particular referral is the one that made the referral. And so we use our behavioral health case managers, our community health workers, our RN case managers to do most of these referrals. But they're the ones that really want to make sure that something happened here, and so I think that's the best workflow.
Great, thank you, Dave. So let me share my screen again. We just have about 5 minutes left, so we're going to zip through some of the things that we've already done here. So just one moment there. Okay, again, so this is what it looks like when it's coming in. The person on their desktop who sees that something came back clicks OK. Then here's the document, which again, like has some useful information in it, but it's kind of hard to read. So then they can view it outside of an encounter here in the history view or inside the encounter in the case information tab. Shannon, I'm going to leave it to you to think about how much time you want to spend on these last slides and whether you want to do the polling questions or not. So just let me know how you want me to have us move forward.
Yeah, I can briefly talk about this. I think this slide is kind of glimpses into the journey that we've taken, thinking about all these topics that you have brought up, these issues of what information to share. I can't necessarily share everything, but I want to share the nuggets that are meaningful in this continuity of care of the partnership. The data mapping is super important. How are we keeping tabs on that data integrity? You'll see kind of the workflow drawn out. In human-centered design, sometimes you just got to get to a piece of paper and draw out how you want the process to happen. And so there was a lot of this effort represented and resulted in the screens and the integration that you saw today. Okay. So if we go to the next slide here. Mallory, did you want me to do this one or did you want to do it? It's up to you.
I'll jump in just to do it really quickly. Number one thing that I think you need to know, if you want to answer yes, we're ready to do this, is the healthcare leadership team on board? If the leadership team is not on board on the healthcare side, this will not move forward. So that's something you need to secure before you do anything else. Shannon mentioned that different electronic health records have different capabilities. So you need to examine and find out, is your EHR, what we have in quotes here, API ready, which in plain language means, is it ready to share information electronically back and forth with an outside system? If it's not ready, do you have access to what's called a middleware provider? In our instance, we're using Qvera, and we had to add to our budget to cover those costs. We also had to look at whether the legal case management system was API ready. Was it ready to share data information back and forth? And then also another really, really crucial piece here, your health IT team needs to be on board and or your HCCN if you're a health center. If they're not involved with planning and implementation from the very earliest moments, it's not going to be successful. And then finally, you also need to have your legal IT team on board. I think we're going to go ahead and skip past these polling questions and have Shannon wrap us up with our lessons learned here.
Great. So I think a lot of lessons learned. Hopefully we were able to answer your questions and we'll certainly keep an eye on them. Certainly conversations about screening and responding to legal problems are intertwined with conversations about screening for social determinants overall, right? It's certainly important, and a lot of it is layered here. If we go to the next point there.
Sure, and Shannon, before I do that, Dave, do you mind just speaking up and talking about how this interrelated with your social determinants of health task force?
Sure, I think, there's so many social determinants of health that have a legal ramification. There's a legal solution to so many. I just think about a patient this week I'm dealing with that lives far away from the dialysis center. She had straight Medicaid, was getting transportation service. Now she's just been declared disabled and lost her transportation service and can't get to dialysis, and we don't know what to do. And so that might be one that legal aid could help us with. So I think it just impacts healthcare so much, and you don't even realize it. I mean, unless you ask, you don't realize all these social determinants are impacting a patient's ability to maintain excellent health. I mean, there's just so many barriers for some of our marginalized patients, and this has just been, just fit really well with our work with social determinants of health, the legal aid part of it.
Yeah, and just to reiterate that, I've heard from Dave and also from our Montana partners, the really great care coordinators at Alluvian Health in Montana, that even patients that you've known for a long time and you feel like, gosh, I really know this patient up and down. When you start asking the legal screening questions, it's like, wow, I didn't even know that there was so much going on. So that's really opened a lot of doors to connections to resolve those issues. Thanks, Shannon. I'll turn it back to you.
Great. And then hopefully you can see from this that it is possible to make legal referrals and close the loop on the referrals. It takes a lot of engagement, and it certainly takes a lot of cross-functional team roles, but it can be done. If we go to the next point, we tried to be thoughtful of a human-centered design approach, and then stemming from that patient, that client, then how they're going to experience it. I think it was definitely a mission-driven approach, thinking and having empathy from that lens of the patient in order to help drive us through, which was also a very positive experience. And then just reviewing with everybody that's involved. So with this sort of medical legal integration, there's a lot of people involved. So you got to just make sure that everyone's informed about the process, and that how consent and referral, that sharing of information is just always overtly discussed, so that everybody's on the same page with what is being shared, so that we're protecting that patient and that client. Okay. And then deadlines. So with something as intricate, with multiple people involved, just making sure that you have project management approach to this, and keeping track of the milestones. Don't think of it as this huge mountain that you have to climb, but think of like every step along the way, and that helps to move things positively. All right.
Thank you, Shannon. So I know from Bethany that we were going to do the polling today right on here, but we were just so chatty that now these questions are going to be sent to you, follow up via email. So if you can please be sure to fill these up, or fill these out rather, when it's emailed to you. I'm going to turn this back over to Bethany. Before I do, I want to say thank you so much to everybody who participated in today's call. Certainly my fellow co-panelists, Dave Faldmo, Erin Planalp, and Shannon Pohl, but also all of you in the audience. Again, we really hope that we've given you a ton of food for thought, and we look forward to learning from you as you move forward on this journey on your own. So Bethany, I'm going to turn it back to you.
Thanks, Mallory, and thank you, everyone. Dave, Erin, Shannon, really appreciate the time that you spent to really do the next phase of this important project, and then present to a larger audience. To the audience, thank you all as well for joining us today in the slide deck, and we're just going to scroll through the slide deck so you can get a preview of what will be shared. You'll definitely get the recording, the slides, and the links that are built into this slide deck with our website, issue briefs that were also covered and referred to, our MLP toolkit, the EHR toolkit. You'll learn more about the first phases of this project, and can continue to scroll down. And make sure that you did register so you can get the links to this slide deck and the recording. And if you do want to reach out to us here at the National Center for any additional resources or assistance, or to find out more about how this team close the loop on a referral. I saw some additional questions too about funding. That's a question we always get. More to come. There's much more to come on that. And so please feel free to reach out to me or Danielle or anyone here at the National Center for Medical Legal Partnership team. With that, thank you all for joining us. Happy National Health Center Week. Please stay safe out there. Thank you for all you all have done to help folks get vaccinated. Mask up, and we'll see you next time. Thanks, everyone.
Thank you.